of at least 2 inches. To perform chest compressions, you should place 2 hands on the lower half of the breastbone. Chest recoil allows blood to flow back into the heart. Incomplete chest recoil is inefficient because it reduces the blood flow back to the heart. It is also important to avoid leaning on the chest between compressions. It is important to minimize interruptions in chest compressions to less than 10 seconds, because each time you stop compressions, the blood flow to the heart and brain decreases significantly, minimizing the chances for return of spontaneous circulation. Once you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels present before the interruption. Form a head tilt, and place the mask on the face with the narrow portion at the bridge of the nose. Use the thumb and index finger of one hand to make a C on the side of the mask, pressing the edges of the mask to the face. Use the remaining fingers to lift the angles of the jaw, open the airway, and press the face to the mask. 2 life-threatening arrhythmias that can cause cardiac arrest are pulseless ventricular tachycardia, or P versus T, and ventricular fibrillation, or VF, where the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain stops abruptly, and the victim loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. Analysis. Be sure that no one is touching the victim, not even the rescuer in charge of giving breaths. Some AEDs will tell you to push a button to allow the AED to begin analyzing the heart rhythm, others will do that automatically. The AED may take a few seconds to analyze the shock. It will charge and then tell you again to clear the victim. Clear the victim before delivering the shock. Press the shock button. The shock will produce a sudden contraction of the victim's muscles. If no shock is needed, and after any shock delivery, immediately resume CPR, starting with chest compressions. Children 8 years and older. For anterolateral placement, place one pad directly below the right collarbone. Place the other pad to the side of the left nipple, with the top edge of the pad a few inches below the armpit. Click next to learn more. For anteroposterior placement, place one AED pad on the left side of the chest, halfway between the tip of the breastbone and left nipple, with the upper edge of the pad below the nipple line. This pad is at the anterior position. Place the other pad on the left side of the victim's back, beneath the shoulder blade, next to the spine. This pad is at the posterior position. The neck, where you can feel the carotid pulse. Feel for a pulse for at least 5, but no more than 10 seconds. If you do not definitely feel a pulse, begin CPR, starting with chest compressions. The adult BLS sequence for 1 or 2 or more rescuers is to verify that the scene is safe. Check for responsiveness and get help. Tap the victim's shoulders and shout, "Are you okay?" If the victim is not responsive, shout for nearby help. Activate the emergency response system. If you are alone, get the AED defibrillator. If someone else is available, send that person to get it. Next, look for no breathing or only gasping and check the pulse simultaneously. Is a pulse definitely felt within 10 seconds? If there is normal breathing and a pulse felt, monitor until emergency responders arrive. If there is no normal breathing and a pulse is felt, provide rescue breathing. Give 1 breath every 6 seconds, or 10 breaths per minute. Check the pulse every 2 minutes, and if there is no pulse, start CPR. If possible opioid overdose, administer naloxone if available per protocol. If there is no normal breathing or only gasping and a pulse is not felt, start CPR. Perform cycles of 30 compressions and 2 breaths and use the AED as soon as it is available. Once the AED arrives, check the rhythm. If the rhythm is shockable, give 1 shock and resume CPR immediately for 2 minutes until prompted by the AED to allow a rhythm check. If the rhythm is non-shockable, resume CPR immediately for 2 minutes, until prompted by the AED to allow a rhythm check. Continue CPR until ALS providers take over or the victim starts to move. Here is the adult BLS algorithm in its entirety. You can download the algorithm by clicking on the link on the screen. Of an unresponsive 57-year-old woman who recently had elective knee replacement surgery. The AED has already arrived at the patient's side. You tap and shout to check for responsiveness, but the patient does not respond. What is your next step after calling for help?